The world produces enough food to feed 7.3 billion people, but not everyone has access to proper nutrition. Every day, 795 million people wake up and go to bed hungry, and 1 in 3 of them suffer from malnutrition. 98% of these people are from developing countries. Most are from Asia. Children are the most evident victims. Every 10 seconds, a child dies from hunger-related diseases. 161 million children under the age of 5 suffer from stunting, and 1 in 4 will not achieve their full growth potential. Eliminating malnutrition may seem impossible in this lifetime, but according to the World Food Programme, it can be resolved by 2030. You can volunteer, help reduce food waste, or contribute to organizations actively solving this problem.
Malnutrition is an ongoing and significant worldwide issue, especially in areas impacted by natural catastrophes, poverty, and conflict. In order to solve this urgent problem and enhance the health and well-being of those who are less fortunate, it is essential that we understand the primary obstacles limiting access to nutritious meals. Limited access to nutritious food is mostly caused by poverty, as low-income households may not have the means to buy or prepare a wide variety of foods that are rich in nutrients. Food production, distribution, and supply connections can be disrupted by political instability and violence, giving communities less options and a rise in food insecurity. Poor transportation systems, inadequate storage facilities, and restricted market access are examples of infrastructure issues that can make it more difficult to find and afford nutritious food.
Malnourishment remains a pressing global health issue, particularly in low-income and developing regions where access to adequate nutrition is limited. Despite numerous efforts to combat this problem, the factors contributing to the decrease in malnourishment cases have not been comprehensively analyzed through quantitative methods. This research seeks to fill this gap by conducting a quantitative analysis of various factors influencing the decline in malnourishment rates. By employing statistical techniques to examine factors such as income level, education, access to healthcare, and food security, this study aims to provide a nuanced understanding of the drivers behind the reduction in malnourishment cases.
Understanding the quantitative relationship between these factors and the decrease in malnourishment cases is crucial for designing more targeted interventions and policies. By identifying and analyzing these factors, policymakers and health practitioners can prioritize resources effectively to sustainably reduce malnourishment rates. This research aims to contribute empirical evidence to inform evidence-based strategies for combating malnutrition and improving public health outcomes globally.
This quantitative research aims to investigate the multifaceted determinants associated with the reduction of malnourishment cases within a specified population. By identifying and analyzing these factors, policymakers, healthcare professionals, and stakeholders can develop targeted interventions to further mitigate malnutrition and improve overall health outcomes. To answer the above-cited problem, an answer to the following will be sought. 1. What is the extent of determinants associated with the reduction of malnourishment cases in terms of A. Malnourishment awareness, B. Healthcare access, C. Government's policies and programs, D. General awareness. Now let's move on to our graphs and tables. For our surveys, we decided to conduct it in Our Lady of Guadalupe with 35 respondents, specifically 26 females and 9 males. 1 stands for never, 2 stands for rarely, 3 stands for sometimes, 4 stands for often, and 5 stands for always. Let's start with the first factor, malnourishment awareness. As we can see, 4.8% answered never, 9% of the students answered rarely, 13.2% answered sometimes, 4.8% answered often, and 3.3% answered never. Now let's move on to our second factor, which is diet and nutrition. It refers to the food and nutrients consumed by individuals and their impact on health and well-being. we get 6% never, 5.2% rarely, 12.2% sometimes, 8.6% often, and 2.2% always. Our last factor is general awareness. This refers to the general awareness of the people about malnourishment, which gives us the graph of 1.8% never, 8.6% rarely, 11.8% sometimes, 8.4% often, and 4.4% always. In conclusion, the research and factors contributing to the decrease of malnourishment cases has shed light on several key elements crucial for combating this pressing global issue. Through an analysis of various factors such as malnourishment awareness, diet and nutrition, healthcare access, government's programs and policies, and general awareness, significant strides can be made towards reducing malnutrition rates. By addressing these factors comprehensively and collaboratively, we can create sustainable solutions that promote health equity and ensure that all individuals have the opportunity to lead healthy and nourished lives. Continued research, advocacy, and action are essential to build upon these findings and enact meaningful change in the fight against malnutrition.